Today I'm here at the Delta Vancouver Airport Hotel, and the government is having another conversation on health with the citizens in the Richmond and Surrey area, and we're going to see what the word is on the street, with hopefully talk to some of the people going into the conversation, as well as there's protesters such as the Seniors Coalition, such as the one right here behind me, which is the Seniors on Guard for Medicare. What is your name?
Rose.
Rose, okay. What are some key things that you want to see change?
See change, yes. Well, maybe we have to come up with both private and public health care.
And why do you think that's a good solution?
Good solution is just everyone be responsible in our own health and our healthcare system.
And what with the privatization, how do you think we would protect the people that can't afford private health care? As in the U.S., there's 40 million people that don't have access to basic health care because of the privatization in the U.S.
Well, don't we have a fund for people who cannot afford for health care? Of course, that's everyone's responsibility to fund also for people who cannot afford health care.
So do you feel that despite the government holding these conversations and being the facilitators of these conversations, that the true voice of the people have spoken?
Well, I think that the voice of the people is shining through. I hope that the government will not, what you might call, stack the information in a way where it doesn't reflect the real conversation, because the real conversation basically tells the government, yes, we need some reforms in the healthcare system. We have to reduce wait time. We have to reinstitute some of the services which were cut, but keep it public and improve it. Don't try to privatize it and lead us down the road of the American healthcare system.
And what brings you here today?
Well, trying to defend the public healthcare system. I think it's very important that we have public solutions to healthcare. Canadians have fought for many, many years to have a Medicare system that everybody has access to. And the Premier's conversation is an important opportunity to tell people that there are viable, workable public sector solutions.
What is your name?
Lorraine Logan.
And you're the organizer of today's protest?
It's not really a protest, it's a rally. It's just an awareness rally. And basically we're forming around the seniors and allies. And the concept, really being is that the seniors of this province and of Canada can remember when we didn't have public health care system.
The provincial government send out a flyer to every householder in British Columbia. But, it's that flyer which really got us very upset, because that flyer basically reflected the position that seniors were responsible for the healthcare cost increases, that we no longer could afford Medicare, that it was pricing itself out of the market, to stack the figures in terms of how much of the provincial budget would be going towards Medicare in the future, which were really trumped up distortions of the truth.
What do you think? What's your point of view on this conversation?
Well, I think, for one thing, I think it was an attempt by this government to say, yes, we are going to listen to the people. I think it's very orchestrated. The exit interviews we've done with people that have already been into these conversations is that it's very structured inside, which, of course, I think it has to be to some degree. But sort of having the open mic concept, people have sat around in the groups, conversations have been recorded, they're sitting on their websites if you want to see them. But at the end of the day, I'm very skeptical about what the results, the government will say, the government I'm saying, inclusively, will say what really happened in these conversations for health.
Well, I was telling you I was involved in the Conversation Health on the North Shore last weekend. And I was quite concerned about the consensus of what people were saying at the table. So, for example, we're talking about private versus public. And one person out of 6 said, I kind of like that, we should have choices. And, choice between private and public. And at the end of the day, the scribes would write up on the chart, this is our key message. And I said, well, why would you write that? There's 5 other people sitting at this table that don't agree to that. But at the end of the day, what's going to be documented is that this table decided the key message was people should have choices between private and public health care. And so that's part of my criticism at the end of the day is how they're going to transcribe that. And it's all based on the scribe's interpretation or deciding what's important, what's not important to go up there. And really the public really has no say at the end of the day. And it's in my opinion, it was all for nothing because they've already made up their mind on how things should be documented.
How are you feeling about this process of the conversation?
Well, there's not a lot of trust in the process because there's many things that the government is doing that leads people to believe that they've already decided to privatize. For instance, you have the care clinic at Vancouver Hospital. You have the Surrey expansion. They all want to do those through public-private partnerships. You have the MSA Hospital. And so it's almost as though the government is predetermined what they're going to do. And so there's not enough amount of confidence in this process, but it's very important that people hear that there are other solutions where they can preserve their public health care system.
I was at the Conversation in Health in Kamloops, February 2nd, I believe, and that went very well. The consensus in the room was that the majority is keep it in public.
And could you tell me a bit more about your experience in the Conversation in Kamloops? How do you feel about the process and the day? Do you feel that it reflected the voice of the people?
Actually, I felt that it did. It was really interesting. Like Fred said, the facilitators were really good. They were open about all the comments. But in the end of it, I commented on how the interpretation of everything that was said in that room was going to be done by the government side. So no matter what we say, there's usually a twist on it, which is really concerning for everybody in that room.
So your name is?
Bill Steamson, and I'm with Seniors on Guard for Medicare.
And you attended the Burnaby Conversation on Health. Can you tell me a bit about it?
I found the experience a little frustrating at times because some of the facilitators had developed a case of hard of hearing problem, you might call it, whenever we spoke about public systems, public health systems. If you mentioned the word private for these few people, they would write it down right away. But if you said the word public, you usually had to pursue it 2 or 3 times before you could get them to write it down. And I wasn't the only one who experienced this because at the end of the conversation later in the day, and the general consensus of the meeting was that most people were very skeptical that all of the, or at least even some of the good ideas that were put forward there would ever be implemented or used by the government in a positive way. So I think the best words to describe most people's experience at the conversation was guarded skepticism.